Hi, everybody out there in my audience, my mental health talks audience. I'm very happy to have my sister here. If you could please introduce yourself.
Hi, my name is Christelle Boca, and I'm Director of Communications and Media for Ontario Conference of the Seventh-day Adventist Church. So if you don't know, the Seventh-day Adventist Church is a Protestant church that is worldwide, and our branch of it is Ontario, which has 34,000 members.
Wow, okay. So, can you talk a little bit about what you do as a communications director?
Yeah, so I'll say that I have some basic functions. One is to inform the public about conference events, conference updates. So like if, there's a major change in our leadership, I would announce that. I promote events. I report on events that happen, whether it's, an event that's conference wide, or it's an event that is put on by one of our many departments, such as children's ministry, family ministry, health, prayer, etc.
Mm-hmm.
And during these kinds of situations, when there's a crisis, I'm also helping to communicate information as necessary to the public. So I meant to say as well, we have different platforms like our magazine, e-newsletter, website, social media, video that I use to basically communicate the information that I mentioned.
Thank you for that. As you're saying that, it sounds like everything that you do involves communication and directly being physically there with people. So that's leading me to ask you, in this time of crisis, specifically where the coronavirus is going around and they're talking about limiting people, limiting gatherings. I know that church services haven't been going on and different things that they usually do with the community. How has that affected your job and how has that affected you personally?
Oh, well, it's changing every day because we keep getting different messages from the government, and we're trying to follow the government mandates as best as possible. So last week, for example, we communicated to churches that according to guidelines coming down from the provincial and federal government, gatherings of 250 or more people were basically not supposed to take place. So that meant that our churches that had 250 or more members had to switch to an online format or meet in small groups. So now the government has mandated that that number is reduced to 50 people. So 50 people now cannot meet. So basically, we are announcing as of today that, for the indefinite future, our churches are not going to meet at all. So
Mm,
that impacts me in different ways. First of all, as a person, I'm not going to be attending church, which is very strange for me because it's something that is part of my life, has been part of my life, my whole life basically. And then all the conference events have been canceled until June, unless things turn around in April. They're going to review in April, but at least until now, until June 24, there will be no conference events. That means that, so my role, which is reporting and promoting, a
yeah.
huge part of my role is not going to be happening really. So basically now my main focus will be um, on helping people navigate through the crisis and just sharing updates as they come. That's how I see it personally.
Okay. So, wow, that's a big thing. And how have you kind of navigated through that feeling of not being able to do your normal routine and the things that have been part of your life for, your whole life, as you were saying?
Um, I'm going to be really honest. Like yesterday, I was freaking out a little bit because I was just thinking all these things are happening and I don't know how to cope with this. And I've never been in this position before where I had to do crisis communication. So it's all new to me,
Yeah.
but what helped me a lot, and this will probably help other people who might be dealing with similar things. I slept for 9 full hours yesterday. I was just mentally and physically exhausted. So I just was like, okay, I'm going to bed early. And, I don't have this pressure of having to be at work as early as usual. So I found that that has helped a lot, because normally I'm averaging 6 hours of sleep. But like
Yeah.
when you are getting enough sleep, you're getting water, you're eating well, it just helps you in general. Exercise, all of those things help you to be able to cope with a crisis. So I would definitely recommend that to anybody